Good day, and welcome to the Stronger Families Through Healthy Relationships, Positive Parenting, and Economic Stability conference call. Today's conference is being recorded. At this time, I would like to turn the conference over to Jen McHenry. Please go ahead.
Thank you so much, and welcome, everyone. Thank you for joining us today. We know you have a lot of time constraints on this first day of fall, and we're delighted you chose to spend part of your morning or afternoon, depending on your coast, with us today. We are the National Resource Center for Healthy Marriage and Families, and we are very glad you came to join us for Stronger Families Through Healthy Relationships, Positive Parenting, and Economic Stability. Today's webinar is going to feature three really fantastic speakers. I think you're going to learn a lot of great information that hopefully we can all take back and use with our programs and our families to keep making a difference. So I'm going to go through a couple of logistics. I'm going to introduce our presenters today, and then we'll be hearing from Robin Senezal, the National Resource Center for Healthy Marriage and Families, Nigel Vance, ICF International, and the National Responsible Fatherhood Clearinghouse, and Penny Tinsman, who's with ICF International, and also the project manager for the Office of Family Assistance, Healthy Marriage, and Responsible Fatherhood Grantee Technical Assistance Project. And so for the first sort of order of business, we will be broadcasting the audio from today's webinar through our speakers. So if you do, for some reason, have any technical issues, problems seeing something, hearing something, you can send us a message in the Q&A box. But we'd also like for you to use this box to ask questions. If you come up with something during any of the presentations, we'd like you to write them in the Q&A box, and it's the right panel of your screen in the bottom right corner. Type in what you'd like us to present to our speakers at the end. We'll collect what is submitted and then address those as time permits. Any questions that are submitted that we don't get a chance to address during the webinar, we will be addressing and making available on our website. So if you're afraid maybe you're a little too close to time, or it's a question that someone may not be able to answer in detail, please ask it anyway. If we can't address it during this time together, we will address it later on. We also have two opportunities for you to get some more information as we go through today's presentations. The first is through a series of web links. Those are going to be in your right-hand panel, and it's that top box. So it says web links at the top, and then you'll see HMRF website, Resource Center, Virtual Training Center, National Responsible Fatherhood Clearinghouse. These links will take you to the websites that we're going to be referencing today. Below that, we also have two files that you can access. You can download to your computer, again, throughout the presentations. First is the speaker bios and contact information for today's presenters, and then also our presentation slides. So for our agenda today, we'll be doing introductions. First, we'll be hearing about healthy relationships. Then we'll be hearing about positive parenting, and finally, economic stability, and then our question and answers to wrap everything together. So our first presenter will be Robin Senezal. And again, for more detailed information, you can download full bios for each of our presenters on that right-hand file box. Robin Senezal is the Senior Manager with ICF International, and she serves as the Project Director for the National Resource Center for Healthy Marriage and Families. In addition to her training and technical assistance work here at ICF, she also brings over 26 years of government experience, specializing in strategic public-private partnerships to strengthen low-income, high-stress communities. She's a certified family life educator and has authored numerous publications on promising practices associated with serving low-income and culturally diverse populations. Next, we'll be hearing from Nigel Vance. Nigel Vance is a Senior Technical Specialist with ICF International, and he's the Resource Development Lead for the National Responsible Fatherhood Clearinghouse. Nigel's worked as a manager and a trainer and consultant with programs for fathers and families in the United States and England since 1988. He's worked on 4 major fatherhood demonstration projects, 4 international major fatherhood projects, 2 healthy marriage initiatives, and many, many other programs strengthening families. He's also the main author of the Fatherhood Clearinghouse Responsible Fatherhood Toolkit, resources from the field, and a Tips for Fatherhood group facilitators of video resource guide, which is a technical assistance project with the Responsible Fatherhood and Healthy Marriage grantees that Penny Tinsman also works with. Penny Tinsman will be our third speaker. She is a senior project manager with ICF International. She has more than 19 years experience training in technical assistance and program evaluation for a variety of different projects. Specifically, she's conducted and coordinated research and training in family strengthening, TANF, substance abuse treatment and prevention, victim services and mental health. Currently, she serves as the project manager for the Office of Family Assistance Healthy Marriage Responsible Fatherhood Technical Assistance Contract and the Economic Stability Workforce Development Technical Assistance project to those same grantees, and she'll be talking through a new conceptual model that project has just unveiled. So without further ado, I'm going to turn it over to Robin Senecal to start us off.
Thanks, Jen. Welcome, everyone. Today's presentation is a really exciting opportunity to highlight the interconnectedness between the work that we're doing at the Resource Center and the work being done by my colleagues in the broader fields of healthy marriage and responsible fatherhood. So as you may know, our mission at the Resource Center is about connecting healthy marriage education skills and safety net services as part of an integrated approach to strengthening families. When we talk about healthy marriage education skills, we're referring to interpersonal skills such as communication and conflict resolution, along with critical skills like parenting and financial education. Communication and conflict resolution skills are not only important in developing and maintaining healthy family relationships, they also transfer into the community and the workplace. For example, a person with poor interpersonal skills may have difficulty getting hired or maintaining employment. And we consider parenting and financial management critical skills as they are the top two stressors affecting most families. Whether the stress is related to potty training a toddler or a teenager that didn't come home last night, parenting can be stressful. Just as financial matters can be stressful, especially for low-resource families trying to achieve economic stability. My co-presenters today are going to share some resources available to support families specifically in these areas as well. Integrating educational opportunities into existing social service systems is one strategy for strengthening the safety net for families who traditionally have not had access or the personal resources to acquire or strengthen these critical relationship skills. Families are more likely to take advantage of services offered in a familiar environment where they're already receiving services. Research shows that children who grow up in a home with adults who are in healthy, stable relationships fare better across the spectrum of physical, emotional, and behavioral categories than do children raised in single-parent homes or in high-conflict environments. By making relationship education skills available to parents, we can improve outcomes for children. These children are less likely to abuse drugs and alcohol, engage in risky sexual behavior, become pregnant as teens, or divorce when they do marry. So let's look at the following cycle of incarceration. As you see from this graphic, boys growing up without their father in the home are 3 times more likely to commit a crime leading to incarceration. Children of divorce are 6 times more likely to be delinquent, and 70% of incarcerated adults grew up in a single-parent household. The visual also represents 3 opportunities for integrating services that can help strengthen families and break this cycle. For example, healthy relationship education skills can be integrated into schools to teach youth about healthy relationships, recognizing what healthy relationships look like, as well as part of a divorce prevention effort to help couples who are considering divorce understand all of the implications and learn co-parenting skills that can help mitigate the effects of that divorce on their children. Or 3, reentry programs. If we know that 70% of incarcerated adults come from single-parent households, Integrating relationship education skills into reentry programs is one way to help these returning parents understand the importance of their decisions as it affects children. These educational opportunities can help families learn skills needed to develop and maintain healthy relationships, as well as understanding that spillover effect that those relationships have on their children. In addition to the family benefits to children and societal benefits related to crime reduction, these skills also have an economic impact. Not only do the interpersonal skills transfer to the workplace, but individuals in healthy relationships are more productive and miss less work. Absenteeism, reduction in productivity, and increased health care due to marital distress cost businesses $6.8 billion a year. All the more reason for job training programs and employee wellness programs to embrace the idea of integrating healthy relationship education skills into the services that they offer. Our next presenter, Nigel, is going to talk more about the efforts to work specifically with fathers to strengthen relationship and parenting skills. And then following Nigel, Penny will introduce a new resource designed to support service providers in their efforts to improve economic stability for families. And I'll come back to join you at the end of today's presentation for some closing comments and to help with questions and answers.
Great. Robin, thank you so much. I think that gives us a really good space and context for a lot of what we're working on. Hopefully some of our attendees, you guys have heard a little bit of yourselves in these opportunities that we're talking about on integrating skills and opportunities to strengthen families. Again, if anyone has any questions, they're kind of popping around your head, you're mulling over right now, you'd like to submit them, you can by using the Q&A pod on the right hand of your screen, bottom right hand. And you can submit that. We'll take them and hold them to the end. And when Robin rejoins us, we'll get a chance to address them. So thank you again, Robin. And now I'll turn it over to Nigel Van. Go ahead, Nigel.
Thank you very much, Jen. Sorry, I had my phone muted. And let me also just apologize in advance here. I'm working in the middle of a building site because I'm having some stairs fixed in a house that I'm house sitting in, and I had given the guy a sort of 5-minute warning to stop. I didn't think I was going to start quite as early. He will be, if you hear noises, they'll disappear shortly. So what I'm going to talk about today is basically so the evolution of the fatherhood work, and look at really where we are now with this work, talk a little bit about what all stakeholders with an interest in child well-being can do, and share a few resources. As you'll see on the slide here, you know, you can date the beginning of fatherhood work back to the 70s or 80s, but initially, at least, there was a growing sort of realization that you couldn't just work with young girls around pregnancy prevention. You know, in the 70s and 80s, we had an increase in divorce, we had an increase in births outside of marriage, and we had concerns about that. You know, it had an impact on the welfare system, and it had started having an impact on child well-being that we've become more and more aware of since. Some of the initial programs were, you know, talking to young girls about postponing pregnancy, and there was support for young mothers, but there was not a lot going on with the dads. And so when I started getting involved in this work in the 80s, there was a growing number of programs focusing on those issues. As we moved into the 90s, there was more concerted efforts to work with the employment system, more concerted efforts to try and do something about child support situations that a lot of low-income guys were getting into that they really couldn't manage. And beyond that, we started realizing that, you know, you can't just work with the dads, you can't just work with the mums, you've got to work with both of them, and you've got to really be able to focus on relationship and co-parenting skills, which is why the topic of this webinar, I think, is so important. And a lot of this early work was just very community-based, actually. When I first started doing the work, I was working for a program in Maryland and started looking around the country to see who else was doing this work. And the further you looked, there was a lot more going on than really met the eye, you know, and I know that's true today. And a lot of that work was not even funded. It was just people in their community seeing the need to do this. And gradually sort of foundations got involved, and there's been a number of major foundation-funded demonstration projects over the years, most of which had some support from the government. And then more recently, since 2006, the Office of Family Assistance has been providing grants for healthy marriage/relationship and responsible fatherhood programs that are now all required to focus on parenting, healthy relationships, and economic stability. So we've come a long way. There's still a long way to go. I mean, ultimately, I've heard a lot of people say this in the fatherhood field. Ultimately, the goal is to get to a place where we haven't got to talk about fatherhood per se, because anybody who's doing family support work with the goal of improving child well-being should automatically be involved in dads. Unfortunately, that's not the case everywhere, but it's certainly the case a lot more than it used to be. So here's just some of the early lessons, really, that were learned in this fatherhood work. One of the things was that, it's in terms of the child support system, it's the only real public policy that deals with dads. You have a welfare system that tends to support single mothers. There's a few single dads out there, but they're 5 to 10% of all single parents. So what the public policy system was doing was giving federal dollars to single parents, but then trying to replenish a lot of those dollars from the non-custodial, or as I prefer to say, non-residential parent. But the fact of the matter was that the non-residential parent in a low-income family situation had no more money than the residential parent, and often even less prospects for getting jobs because they didn't have the same kind of supports. There was interesting research in the 90s that really pointed out this difference. It was led by people like Elaine Sorensen at the Urban Institute and Ron Mincy at the Ford Foundation, showing that although there's a lot of dads out there who had child support that they weren't paying, they're actually the minority in terms of all fathers with child support orders. And I'm not sure how it breaks down nowadays, but at that point you could look at who owed child support, and about 50% of everybody who owed child support paid most of it on time. Of the other 50%, about half of them had the money to pay a good chunk of it anyway, but didn't pay it all for various reasons. But the other 25%, half of the ones who weren't paying, the reason they weren't paying is not because they were deadbeat, which was a term that was used a lot in the child support circles back in the 90s. They weren't deadbeat, they were dead broke. They had no money, they couldn't pay. They had no way to get jobs. They didn't have a good educational background, they dropped out of school early. And as Robin pointed out, a lot of guys, particularly coming from low-income backgrounds, ended up being incarcerated. There's obviously some issues with that whole system. So child support really recognized that back then, and the child support system at the federal level and a lot of state systems has really embraced now the need to not just go after dads for money, but to help dads get jobs so they can pay that money. On a personal level, with this research that came out of the Partners for Fragile Families study in the late 90s and early 2000s, and we can say fairly definitively that, if you're married, you're there with your kids, and hopefully you have a good relationship. So it's, I've always felt that if you bonded with your kids in the early months, the early years, a dad can't walk away from that. Some dads can, but the majority of dads can't. I challenge any man to hold a newborn baby in their arms and not want to be involved in the life of that child. It's more complicated when you're not married to the mother and not living in the home with the mother, or maybe not even in a romantic relationship at the time. But even then, a lot of guys really do want to be involved. And if you ask them at the time of birth, which is what they did in the Partners for Fragile Families study, the vast majority of unmarried parents, mothers and fathers, said they intended to stay together. It's just hard. It's hard particularly if you haven't got a lot of money, as you struggle that. And so a lot of unmarried dads do become less involved as their kids get older. So one of the things that the fatherhood and healthy relationship work can do is to really help those couples maintain a co-parenting relationship, even if it's not a romantic relationship. And that's where a lot of other stakeholders really come in here. That we should be challenging everybody who's working with children, everybody who's working with families, which tends to be mothers in a lot of settings, that if you're doing that kind of work, you should be looking to involve the dads. And it's often, as I've got on that last bullet there, it's an issue for staff training sometimes, because it sort of becomes an unconscious thing. But if you're used to working more with mothers, you perhaps don't look out to find ways to engage with dads, or you've perhaps not had a good relationship with the father of your own children or other men in your life, and you unconsciously are putting that on to some of the men who you might be able to more positively engage. So it's important to do some staff training and allow staff, particularly female staff, the opportunity to process some of those things. When you look at the dads who've been involved in these programs, it takes time. I remember one of the very first programs I was involved with as part of a national demonstration in the early 90s. They had a big kickoff meeting, and I was a project officer for this national project, and so I was invited along with a lot of their partner agencies, and they had a whole spread of food laid out, and we went along for this grand opening, and they talked to 25, 30 dads who told them they'd be there. Turned out 2 dads showed up, and you could have just, pricked the atmosphere in the room with a balloon. Everybody was so deflated. That wasn't the right way to say that, but the good thing about that was I was back there a couple of years later for a graduation ceremony of a full class of dads who had their families and kids there, and those 2 young men were actually on staff then. So the message in trying to engage dads is they will come. It takes time. You've got to have the right staff, the right approach. More than anything, you've got to have something real for them when they get there. If you get some guys in the program but then don't have staff who make meaningful connections or services that can really help them, they're not going to stay, and they're not going to talk well of the program out in the community, and so it's going to be harder to get other guys. If you talk to people about what does it take to bring dads into a program, the number one thing you're going to hear is word of mouth, and word of mouth comes from satisfied customers. So what you do once you get them in there is so important. And I've underlined the word love in that third bullet there, because I've done quite a few sessions where I've had a panel of fathers who, as part of staff training sessions for new staff, and bring some dads in from a local program who've been in that, involved in a fatherhood program. And one of the things I would always ask them is, what kept you in this program? What kind of things did you get out of this program that you would recommend to other people? And almost in every instance, at least one of the guys would use the word love, because that's what they felt from the staff who were engaging them. And I always talk about the fact that staff of these programs form a heart-to-heart connection with the men they work with, and a lot of these men have not had that kind of stable, nurturing relationship from adults in their lives, and so they really tend to respond to that. You've got to find good times to engage with dads, and prenatally, it's a time when a lot of dads, young dads, they're not going to come running to your program necessarily. If you can connect to them, you may find they're more open to hearing something because they're scared. They don't know what's coming. Same thing when you're going through a divorce or a separation. You want to talk to other people about this. You don't know it, but you put a bunch of guys in a room together and create a safe place for them to start talking. They're going to grow together, and you're going to be able to guide them on this journey where they go places they didn't even know they could go. A lot of the reasons that guys do come to a program beyond, sort of the need for some help with what am I going to do when the baby's born, how do I manage this new child I've got, what do I do in terms of helping mum. A lot of the other issues that guys present with is they need a job, and they need a better job so they can pay their child support. A lot of guys who are not in the home have these child support orders that often get set higher than a lot of the guys can pay on a consistent basis. And the other big issue is I want to see my kids, or I want my kids, and that's across the board. It doesn't matter what income level you are. You get divorcing dads coming into these programs who are angry. One of the things a program can do is let folk vent that anger, but help them understand, it doesn't do you any good, it doesn't do your kids any good if you're angry at mum, if you're angry at the system that's, you, in your view, not supporting as well as it could. So helping guys to see that, and then really helping to unearth some of their deeper needs, helping them get that job, helping them get the qualifications, and helping them get the skills to talk to mum, the skills to be a good father. And you have to help them address various challenges. There's all sorts of stuff going on out there. It's very interesting actually. If you look at the income of young men aged 16 to 25 back in the mid-70s, those wages have gone down consistently in terms of real wages since then, at the exact same time that the child support system was founded. So, if you're poor, it's very hard to get out from behind that 8 ball. If programs can help you get a few steps up the ladder, it can be immeasurable. And a lot of the things that Penny's going to talk about in her presentation is how programs can do this kind of case management, for employment, but it's the same in terms of the general issues that a lot of dads face. So what fatherhood programs can do, particularly in terms of working with other stakeholders and other people that work with families, they can bring the men to the table. A lot of times I've done a lot of work with Head Start agencies, for instance, that are required to do male involvement activities. Don't have a lot of funds to do it, but often struggle to really involve dads. And I've heard a lot of staff say, well, we can get mums in, but we can't quite figure out how to get the dads in. You do have to do it in a different way. You've got to talk to men differently than you've got to talk to women sometimes. You need to have some male presence, but it doesn't mean you can't have female staff who can totally connect with men. And once you've got guys at the table, it's like any good healthy relationship program, any good family support program. You make them feel comfortable, you help them really look back at where they've been, what their journey's been, what their parents' lives were like, what their grandparents' lives were like, what their relationships were like with each other, and what's the whole impact of that been on who you are today. And then take a look at what are your strengths, where do you want to get, how are we going to help you get there, and engage people in some really good one-on-one but group activities where they can grow together, and as their self-realizations grow and their willingness to embrace new skills grow, you've got to have skills and tools to share with them. So what a lot of good fatherhood programs do is, they help guys understand child development. They help them understand good communication and listening skills. You've got to try, as I said at the beginning, to work with both parents. It's not always possible. If you can't work with both parents, you've got to try and empower the one you are working with to have the skills to talk differently to their partner. One key skill is you lower your voice, the other person lowers their voice. You raise your voice, they raise their voice. So let's not get into these knockout, drag-out fights. Let's just sort of try and take it easy, but show that we're trying to do things differently. You've got to work with other folk in the community who can help you provide all these necessary supports. You've got to be able to provide the necessary skills. You've got to talk about domestic violence. What other stakeholders can do, who are not necessarily engaged with dads now, but encourage all your staff to not just engage with the dad who might be in the home, who could be a stepdad, it could be the biological dad, but try and involve the dad who's not in the home. And as I said before, do some staff training to help staff process their own stuff, but also think about, well, how are we going to do this? How are we going to create this father-friendly environment? What does that mean? It means all staff have got to talk positively about fathers and the fatherhood program aspect of your services. One key thing is, what does your mission statement say? A lot of Head Start programs, again, that I've worked with have a mission statement that talks about child well-being and family support, but it often doesn't use the word, it uses the word family, but what does that word mean? In the community, they may well associate family, particularly with particular agencies, with mothers and children. So I encourage agencies to change the language a bit. On your brochures, don't say support for families, don't say services for parents. Say we work with mums, dads and kids. Put the word dad and father in wherever you can. And compile a list of local resources where you can help mums and dads see where they can get other support. Now here's the toolkit that we have at fatherhood.gov, the National Responsible Fatherhood Clearinghouse that Jen mentioned. So the materials you see on the screen right now, they're part of what we refer to as Volume 1. They've been up for just over a year now. You can go to fatherhood.gov/toolkit. You can access activities to work with dads. You can access tips from folk who've been doing this work for a long while. We interview people. We put their ideas in there. We borrowed some resources from programs that you can download. You can download activities from most of the major fatherhood curricula out there in the field, and you can, if you've got a group of dads who are getting ready to meet tonight and your guest speaker didn't show up, so and you're wondering what to do, you can go there, download an activity, and try that out. This is new material that is going to be up very soon. I've highlighted the one section which is on working with dads around relationship skills, but we're going to have all this material up within the next few weeks. And in the section on relationship skills, we provide various tips for practitioners working with dads in different family situations. There's a lot of complex family network situations out there, so we talk about ways to work with dads who are in the home, dads who are out of the home, dads with blended family situations where maybe they've got some kids in the home, maybe their partner's got some kids in the home, but maybe you've both got kids in other households. So you've got step-parenting relationships, you've got multiple adult and child relationships to manage that all need to be positive if kids are going to be well. We talk about ways to do effective communication, tips for dads in all those different situations. We stress trying to provide mediation with mum and dad if possible. That's been one of the trickier things for the field to do. If you can't work with both, maybe have a third mediator who can come in and talk with both of them. We've also got a new research to practice brief that's going to be online at the Clearinghouse very soon that looked at good practice for parenting programs in general and has applied those to how fatherhood programs can do it. And basically what it said was that parenting programs that encourage, that do modeling, where the facilitator models things you can do with your kids of different ages, and also where parents have the opportunity to bring their own kids in and practice some of the things you've been talking about and then get feedback from the staff. Those two things have proven really valuable and could well be valuable in work with fathers too. And I've often stressed in talking with fatherhood programs, if you go to a program for mothers, you tend to see kids. You go to a program for dads, you don't see kids as much. If you're a fatherhood program, you should be talking about relationships, you should be talking about parenting, you should be talking about kids and have kids present. Here's a list of some of the resources available at the Clearinghouse with the links, and you'll have access to this. You've got access in your screen at the right there, and you'll have this afterwards. One thing I want to emphasize on this slide is the call center helpline at the bottom there, 1-877-4DAD-411. This is a number that dads and mums call, about 50% of each. A lot of times it is folk who are not getting along very well together. The counsellors can actually get mum and dad on the phone together and talk them through situations. They can also provide contact information locally for other resources. And it's not just for parents, it's for practitioners too. If you have a couple you're working with, or a mum or dad, you can call that number and you can get some ideas for local resources that you might find would be of help. And that's me. I will turn it over to Jen to introduce Penny.
All right. Thank you so much, Nigel. That was great. We got some questions in. And again, I'd like to encourage anyone who's got something for Robin or Nigel or Penny coming up to continue to ask those as well, again, using the Q&A box on the right. So some good things coming up at the end of Penny's presentation, but some good things immediately as she talks us through the Economic Stability Workforce Development Conceptual Framework. Penny?
Good afternoon, everyone. I want to thank Robin and the Resource Center team for inviting me and Nigel to present today on a brand new tool that we've developed through working with OFA, the Office of Family Assistance. We are the National Healthy Marriage Responsible Fatherhood Technical Assistance Contract, And we provide technical assistance to those healthy marriage and fatherhood grantees that are funded through OFA. Currently, there's 120 grantees, 60 of which are healthy marriage, 55 are responsible fatherhood, and then there are 5 that specifically work with a population that is either incarcerated or recently released. So we refer to those as the reentry grantees. I would like to start out also by saying that there is a key component for this particular funded grantees that really revolves around economic stability. For the fatherhood grantees, it is one of 3 authorized activities that they must offer in their grant program. But all but 6 of the 120 have some form of economic stability efforts. And it runs a gamut across the continuum. Some of them provide a very, what we like to call robust, so maybe there's on-the-job training, subsidized employment, while others offer much less robust or more passive financial education, financial literacy programs. But nevertheless, very, very important, and depending on your program, most appropriate. OFA, through the funding of this current round of grantees, realized there was a lack of consensus on the best models for economic stability activities and services. Further, there was also a huge lack of economic stability, of knowledge in economic stability activities and the way that those activities are implemented. And finally, with the Healthy Marriage and Responsible Fatherhood programs, there's another challenge as well, as integrating that component into those specific programs. What OFA did was to fund a separate contract to provide technical assistance to these grantees that was specifically centered around economic stability and workforce development. The project that I'm going to discuss is really the output from that from that contract and the information that we've gathered. As we began this process, we developed a model. We did extensive research and prepared literature reviews, and we vetted the information with a round of experts, of practitioners, policymakers, and researchers to get the best model. And the model that I'm going to present is what we have come up with, and I hope that it will be useful to you. The Conceptual Framework, which is what I'm going to talk a little bit about, was developed to specifically help healthy marriage and responsible fatherhood grantees, but it is useful for any community-based program. So we wanted to make sure that these grantees are being provided with the best, and if other programs are being provided with the best information and a very comprehensive look at how to provide economic stability efforts in their programs. As Nigel mentioned, a lot of what I'm going to discuss is based off of I wrote down fatherhood participant needs. Most of the fathers and the couples who come forward are looking for a job, that they need a job, but they need a lot of other things as well. So finding the job can be the end component, but we also work with them to make sure that they are receiving a multitude of services as well. There are 2 pieces of the conceptual framework that I'm going to talk about. One is we could refer to as a model, the conceptual model, which really provides the overview, whereas the next piece, the process map, provides the participants look at the model. It's the path that the participant will take through this framework. These are the 2 lovely pictures of the model is on your left with the 5 key components, and then the process map on your right, which we'll talk a little bit more about. There are 5 key components of the conceptual model. There's intake, baseline, and assessment, capacity building, connecting to jobs, work retention and career advancement, and then probably I always like to say, it's probably the most important, it's the center of our model, which pulls all of these others together, is the case management, client plan, and supportive services piece. Let's start at the top of the model with the intake and baseline assessment. essentially, this is when the client comes in the door, or your participant comes in the door, you're going to assess them and screen them for their personal needs and barriers. That could be health and physical and mental health issues, the health and behavioral issues of their children, if they're involved with the child welfare services, if there's a substance abuse issue, if there's domestic violence issues, if they're involved in an unstable housing situation. Then you also are looking at their logistical and human capital barriers, which could be their lack of education, language barriers, lack of work experience, which can be a problem, and also their involvement with a criminal background. You also want to look and assess their job skills and experience. That can be a very formal aptitude and ability testing, or it could be something much less formal, in that it is very much just your case management experience and talking with them, and what your assessment, very informal assessment as well. It could be your basic skills or learning aptitude. Also, we talk a little bit about motivational interviewing. And for those of you who aren't really familiar with motivational interviewing, it's really come to the forefront, and it is a collaboration of a person-centered form of guiding, to elicit and strengthen the motivation for change. If your client or your participant's not ready to change, it's hard to get them to move along any continuum, much less to get them to a job and get them ready for a job. Your case management, this is, to me, the most important. I think I've already said this. And this gets back to when you're meeting the needs of your client. As Nigel mentioned, the fatherhood participant needs, the healthy marriage participant needs. They come in, and you have to, when you're working with them to develop their client plan, their client objectives, you're going to be coordinating their services across providers, connecting them with, creating the personal connections with the participants. And this cannot be, undersold how important that personal connection with your participants are. Assisting them in navigating service systems, if they are dealing with a child support issue, helping them work through that. And then connecting the clients to services that address their personal challenges. If they have a child care issue, if you're having them come in for a program, or even when they are employed later in the program, providing the child care on site, helping them pay for the child care. Nigel mentioned this as well, in a program, a fatherhood or marriage program, or any of your programs as you're preparing for job readiness, involving the children, bringing the kids with them. That's really can be very effective. If, as I mentioned, if they have a substance abuse issue, make sure they're screened. Provide them access to a local sensitive drug treatment facility. Establishing that partnership with your participants is extremely important. Several programs also work with transportation issues. They'll provide vouchers or tokens for transportation, for public transportation. They can offer reimbursement for transportation costs, or sometimes they provide gas cards. And again, this can be for either going to your fatherhood or marriage program, but also for going to your job or to an interview, or what have you. It's very, very important, as I mentioned, to match the plans, whatever you're developing in your case management plan, to the actual client objectives and their short-term or long-term goals. Your capacity building is extremely important as well. There's three key components: financial management and asset building. In this area, you can teach them building their, we call it money skills and knowledge, balancing their income and expenses, being a wise consumer, and building their assets. Their interpersonal skills and job readiness. You're talking about their soft skills. Soft skills can be a lot of times referred to as communication skills. Job search skills, building the resume, knowing how to act as a professional when they are on an interview. Those kind of things are also extremely important. The job-related education and training, making sure they have the basic educational needs for any particular job that you are trying to place them. If their job requirement is that they have a high school diploma or a GED, making sure that they have that. Making sure that they have, for a focused or a job-specific training, if they require, if a job requires a commercial driver's license, making sure that they have attained that expertise and that certification. I'm going to back up just for a second and talk a little bit about financial education. There are 6 key strategies that we use, there are 6 strategies for financial education that are addressed. There's savings, the getting banked, which is, making sure they know to go to the bank and not hide it under their bed. Managing credit and their debt, the importance of their tax credits, their earned tax income, and then assessing the federal and state benefits. Again, the EITC is a very big piece there. Connecting to job openings, there's 3 key components here as well: job development, job placement, and transitional support. The first is the job development, building your relationships with potential employers and other partners. When you're reaching out to potential employer partners, speaking the employer's language is really important. Marketing the benefits of hiring your candidate, and stress the level of support that candidate will get, or that they've already received and will maintain and continue to receive while they're employed there. Also talking with your job placement. Focus on the value added for your employees, again, or for your employers. When they're hiring your program participants, focus in on, again, the support that they've received already to prepare them to be a good employee, but also what you're going to be continuing to share and to build with them. Again, preparing your employers for your job coach, to be a job coach. I'm sorry. They will continue to provide training while that person is employed with them. Also the transitional support, if it's necessary, subsidize, if you can, the employment. The ultimate goal of subsidized employment is unsubsidized employment. So making sure if you can put a little bit of subsidies that maybe for 30 days you'll help subsidize an employee's benefits and wages, and then after that 30 days, that if they've met the requirements of the employer, that the subsidies would discontinue, because at whatever time frame it works. But building that relationship with your employer partner is extremely important. It's also very important to build that relationship and to not put forward an employee that's not a good match. You want to be able to build and continue to build the relationship with the employer partners so that they know that folks coming from your programs are good matches for their program or for their jobs. They'll come back to you if they have a job opening because they know you're placing good people. So building that relationship is extremely important. Work retention and career advancement. Again, incentives. We in the private sector we call them bonuses. That's great. So if it's if your employer is, if your program participant is employed, then they're going to be able to receive an incentive. Sometimes that can be a very an incentive that they will receive help getting to and from work. We talked a little bit about transportation assistance. Again, the EITC benefits, as well as ongoing support that they're going to be receiving or that they can receive from the program. Again, even after they are placed in a job, they are still dealing with maybe family struggles or housing issues or what have you, that those kinds of, and continuing to build their communication skills and to better themselves, it can be an ongoing support. Additionally, new things may come up after they've been employed. So maintaining that relationship with your participant and making sure that you're addressing any new challenges is also extremely important. We also talk a little bit about upskilling and career advancement and enhancement. You want the folks to be moving along the job, the path to a career and to a long career so that they're receiving, that they're bettering themselves. Maybe they start out at a part-time job that ends up being a full-time job, which then can take the next steps. And we've had several programs report extremely high success rates with their participants after they've been placed, that they are now, a recognized person at that company, that they have moved along the ranks of the employees and now are supervisors and what have you. So moving them forward and upskilling them and making sure that they continue to move along the continuum. Again, as I mentioned, the conceptual model, the process map of the model is really the participant's route, if you will, through the process of, of workforce development and economic stability. It's really hard to see on the screen, but I'll show you, I think, in a better picture in a minute. The first three boxes at the top are the intake and assessment, and then the middle piece is the where you're talking about your case management on the left, and then you talk about your connecting to jobs and your capacity building on the right, and then ultimately your employment and the maintaining the support and your upskilling of the individuals. It's also important to notice the wraparound arrows are talking about the social programming and making sure that they are you're always meeting their needs or working with them to meet their needs, as well as personal transformation. We talked a little bit about motivational interviewing earlier, but moving that participant along the road to making the change and being ready to change, and those are extremely important aspects as well. And here's a little bit better picture. I knew I should have flipped the screen. As you can see in the middle, you're talking about your supportive services in the lavender area. We've talked about child care, peer support, substance abuse, transportation. We talked a little about child support. And then you have your connecting to jobs and capacity building on the right. And again, you can see the wraparound arrows there. We've talked quite a bit about, or I keep saying we, I've talked quite a bit about the factors that impact the implementation of the model, the motivational and personal transformation. When they're ready, they'll make the change. So helping them along that line to get ready is extremely important. Making sure that your programs understand the labor market conditions where they are, where your program is located, can be extremely important. And there's lots of information about labor market readily available on the internet. Also recognizing cultural sensitivity and the importance of cultural sensitivity. And that can be both, as the culture of, your ethnicity, but also the culture that some of these folks are coming from. For example, the incarcerated or formerly incarcerated, if folks presenting with a criminal background, that's a whole special issue that, your employer partners need to be prepared for as you're trying to place your participants. Because if someone's presenting with a criminal background, they may not be the right fit for every job, or that they can't be because certain employment areas do not allow individuals with a criminal background or a drug, a substance abuse history to be employed in that area. Finally, as I mentioned, these were developed to help OFA and the OFA grantees, the Healthy Marriage Responsible Fatherhood grantees, to distill, share, and incorporate practices into their programs that would better help their program participants reach economic stability and in their search for jobs. As I mentioned, again, a lot of what I talked about was based on Healthy Marriage and Responsible Fatherhood grantees. These programs and this workforce strategy is effective for all of the programs, community-based programs. I'm going to ask Alan if he can share a little bit on the HMRF website. Thanks, Alan. As you can see, this is a brand new, I think it was launched in March. It's the new HMRF website. It's hmrf.acf.hhs.gov. This is OFA's Healthy Marriage, Responsible Fatherhood website, and there's a lot of hopefully really helpful resources here that are available to the public, not just to the grantees. Only if you go to the toolkits and trainings, you'll see here there's the toolkit at the top is a within reach, the strategies for improving family economic stability, which is what I just walked you through. But additionally, there's one right there underneath, which is a fatherhood group facilitator guide that Nigel, the previous speaker, was very, very involved in. Also on the left-hand navigation side, on the right navigation, you'll see 3 areas, the highlights from the field, which if you click there, it will provide you with some stories of highlights from grantees. Also some quick facts if you have some questions about the Healthy Marriage grantees. And then as well as the bottom, if you're curious about where any of the programs, the Healthy Marriage programs are, you can go to find a program. Alan, could you walk us through the toolkit page, please? Thank you. As you can see, and Alan, just scroll down a little bit, it starts out with the introduction, and then there's the model. It gives a little bit of an overview, and then it will walk you through. Keep going. It's a long page. Each of the modules within the toolkit. So if you clicked on the intake baseline assessment, it will provide you with some resources about and how to help your program implement those pieces of the conceptual framework. I'm happy to take your questions. I hope you have some for us, and I'll turn it back over to Jen at this point. Thank you again.
Great. Thank you so much, Penny, and thank you again to Robin and Nigel as well. So we did have a couple of questions come in, and again, if anyone has anything additional, please continue to send them to us using that Q&A pod in the bottom right of your screen. You can type it in and hit enter, and we'll get it in the queue. One thing we did have someone ask, and so I'll just reiterate in case anyone had a similar question, about the 8774-411 number that Nigel mentioned during his presentation with the National Responsible Fatherhood Clearinghouse. That phone number is toll-free. It is at no cost to the person dialing it, and it is no cost for your program if it is something you'd like to direct people to. So feel free to use that along with these other resources at no cost. The first question I'd like to ask for Penny is where could someone find out about Healthy Marriage and Responsible Fatherhood programs that are in their area?
That's a great question. On the website that we just showed you, on the right-hand side, you'll see a map. If you click on the map, you can go state by state, and it provides you with all of the Healthy Marriage and Responsible Fatherhood and Reentry grants, and then a little bit about each of those grants as well. And if there is a website available for the grant, it will provide you a link there as well.
And actually, Jen, if I could chime in on that, if folks want to go to the National Responsible Fatherhood Clearinghouse website, fatherhood.gov, we also have profiles for each state there that lists various resources for healthy relationships, fatherhood, and economic stability work.
Right. And Nigel, just to second that, Nigel, I think yours is a little bit wider than just the marriage. I think all the marriage and fatherhood grantees are there, but I think it's a little bit wider area as well.
That's right. Yeah, it's only state or federally funded resources, but it is wider. Yeah.
Great. Excellent. So another question that's come in and is related. For someone interested in starting to integrate or starting to talk about one of these 3 components, maybe all of the components, what are some tips that each of you may have for starting involving dads more, starting talking and thinking about economic stability, starting to talk about healthy relationships and those critical skills? Let's start with Robin.
Sure. Well, I think one of the first things that any organization needs to assess whenever they're thinking about adding on new components is, what is their current service delivery system? What does that look like? And then what makes sense in terms of the needs of the clients that they're serving? Bringing in a whole bunch of new ideas just because they're new and interesting ideas may not be the most appropriate strategy. So I would start with assessing service delivery systems and then perhaps thinking about integrating the different services using the levels of integration that the Resource Center uses. Level 1 is basic integration. That could be simply informational handouts in a waiting room, whether those handouts are 10 tips for healthy communication or brochures on the Community Healthy Marriage grantee or Fatherhood program. That's basic engagement. Or developing a partnership if you identify, for example, that the cooperative extension agency in your community is offering financial education classes, financial literacy classes, bringing that partner in to offer those classes to your clients, or developing a cross-referral system with that agency might be a good strategy. Or if you're really in a position to fully integrate some of these new ideas, maybe consider how you might integrate the strategies for improving family economic stability that Penny talked about, downloading all of that and actually integrating it into the work that you're doing. That might be a strategy. There's also healthy relationship curriculum available on the Resource Center website in the virtual training center that might be an appropriate curriculum to integrate. But I would start with an assessment of your service delivery system and your client needs.
Great, thank you. Nigel or Penny?
Yeah, well, I mean, oh, go ahead.
Thanks, Nigel. I would just second what Robin just said. And taking an assessment of your program and what you're trying to accomplish, and knowing that with your service delivery, how important your the supportive services are in. Even if your goal is economic stability for your program or for your participants, and that's what their goal is ultimately when they come in and they need a job, and helping them understand that sometimes that can be a very, very hard sell, but they need a lot of other pieces as well. And one thing that I didn't mention, and I should have, is not providing services to them that they don't need. If they don't present with a particular issue, having them receive services for something they don't need is also could be detrimental to your program and to their actual goals and objectives, their individual plans. Sorry, Nigel, go ahead. Your turn.
Okay. Well, I certainly echo everything that's just been said. I think particularly not to try and stretch beyond your core mission. I think sometimes we trip ourselves up because we will go after a new grant, say, and try and do something that's really sort of beyond what we have been doing. But as I said during the presentation, if your mission, your goal in any way entails family strengthening or enhancing child well-being, then that means you ought to be engaging with mums and dads. So to the extent that an agency may not be having a lot of success engaging with dads, then I think take a step back and talk with all the staff about, well, why isn't this happening, and why is this important? It's very important to really be clear with everybody on the staff the benefits of both parents being involved in the lives of a child. Everyone's got to buy into this, as I mentioned. Do some staff training, but talk to some dads. Talk to some dads in the community and get a sense of what they think of your agency, and help them perhaps develop a more positive attitude if that's not what they've got, and talk to the dads about, well, what might be interesting for you to come in, and what could we do to help, and have a male on staff. Having that male face makes it much easier for a man just to walk in, but as I said before, it's not the be-all and end-all. I've seen many, many women do fantastic work with men without any other men on staff being really involved. Make sure that the first person anybody talks to is father friendly. So if a young man walks into your agency with his pants halfway down his waist, don't be thinking stereotypically about who he is. Embrace him as a young man who cares about his kids, and really look for the strengths in everybody. That's a few thoughts.
Great, thank you. And Nigel, you actually proactively addressed another question that someone asked about what to do if your staff is all female, and that's a great point about making places engaging. Do you, this is a bit of a plant question because I do know the answer, but where would someone find tips on how to assess whether or not their organization is being father-friendly, and maybe start to assess how they are in terms of being welcoming to dad?
Okay, so you'd call that a setup question, Jen, right?
It's a little bit of a setup question.
Yeah, there is if you go to our Fatherhood Toolkit, you can download a father friendliness assessment tool. It was actually developed back in the 90s. I had a hand in developing it. It was developed for the National Head Start Association, and there's a slightly different version of it that's available now for Head Start agencies through the building blocks. And there's other ones out there. I think I saw that Neil Tift was part of the audience for this, and he developed one many years ago, and I'm not sure how available that is now. And the National Fatherhood Initiative has one available as well, but you can download that one from our toolkit anyway, and it's broken down into 5 categories to take a look at various aspects of your agency, and you can have staff get together in small groups to assess things on a scale of 1 to 5 or 1 to 10, and then you can come up with where there's some areas for growth, and then start talking about ways to improve things. But I think, again, involving all the staff in that is key. You don't want to just have one person whose job it is to engage with dads or with mums, or to do the employment bit. You want everybody on board with the importance of everything, so everybody is talking it up with everybody they meet.
Great, thank you. Another question we got in was from a group that serves as a domestic violence shelter, but also facilitates parenting programs in their local area. So they provide a lot of resources and assistance to clients, but her question is about ways to motivate and keep clients following through. And I'm going to add in, I'm thinking this is particularly in terms of both the programming and some of the economic stability components that we talked about with Penny's program. So whoever would like to take a first swing at how do you keep a client involved throughout the whole process?
Penny, you want to start with that?
Jen, could you give me a little bit, could you repeat that a little bit? I'm not sure I followed exactly what the question was.
Sure. So for clients who are in a program, and you're wanting them to go all the way through, particularly I'm thinking in terms of the framework that had a number of steps. What's a good way or some ideas that you can keep someone involved throughout that process so they're getting the most out of what's being offered?
Sure, and I think that gets back to your case management piece. Having the case manager very involved. When they're presenting with multiple issues, and it can be domestic violence, it can be substance abuse, it can be, as I mentioned, housing, it can be whatever it is. While you're trying to work with that, that's building the relationship between your case manager and your participant, being that resource, making sure that the services that the participants are receiving are good and that they are culturally appropriate for that individual. I think it gets back to something Robin mentioned earlier, just the assessment of your service delivery. But case management plays such a crucial and vital role in that. And while they're working through, or you're dealing with maybe a domestic violence issue, you can also still be working on their soft skills or the other pieces of that. And I think that is, where that's appropriate, I think that's helpful as well. But I think it all boils down on, to your case management strategy that your program is implementing. I hope that's helpful.
This is Robin. I would just add that one of the most important things to keep in mind whenever you're dealing with adults is the adult learner theory. And the theory basically says that adults need to feel empowered and they need to feel the relevance of whatever it is that you're wanting them to learn. So getting back to what Penny said, if they're presenting with multiple issues, making sure that you're addressing the issues that they consider to be the most critical, the most urgent first, is a great way to kind of start building that relationship, and making sure that any type of educational programming you're providing to them is done using adult learner theory and not like you would teach a child where you expect them to come and to sit and to simply listen and be lectured to for a period of time. If adults value the information, they will stick with the program. Sometimes they have scheduling challenges and they have other barriers, and making sure you have strategies in place to help overcome those barriers so they can participate is important. But for the most part, people will do what is important to them. And so communicating that value, using your case managers to help them understand the value of what information they're going to learn from these different components of the program is really key to getting them to start and stick with a program.
Right, and this is Penny again, and also one of the things that we briefly showed when we were looking at the website is the toolkit for facilitators that Nigel was instrumental in helping us to prepare. Provides, and it's actually it has video clips that can be also very helpful with the adult learning component as well.
Yeah, I think what Robin said was particularly on point there. I mean, very eloquently put, Robin. It's like, I think the key is we've got to understand that folks' lives are complicated, right? And actually, if you help people get a run up that ladder that I was talking about, life gets more complicated. So if you're now more involved with your kids, or more involved in the education program, more involved in the training program, more involved in the job, it gets harder to keep coming to classes. But I think if you form that upfront relationship, and also that you've got this sort of real connection with the folk in the program, as Robin said, they're going to see the value of this and they're going to keep coming back. I think a lot of it is just from first contact that you listen more than you talk, and you form a relationship. And if there's something real going on, people will try and get there, but there'll be times when it's difficult. So you do need to check in with them, sometimes before a session, or if they don't make a particular session, make sure that somebody touches base with them before the next one, just to sort of see what's going on. And if it's not a staff person, it can be a fellow participant sometimes, can sort of check in. It might be a transportation issue. It might be that there was a change in the job shift they had to work. It might be a childcare issue. So let's find out what's going on and see how we can help.
Great. Thank you so much. We do have a few other questions that have come in, but I'll remind everybody, please send questions in. Also, you can send them to info@healthymarriageandfamilies.org if you think of anything afterwards. We'll be addressing them in a question and answer document that we'll be posting to our website. So I'm actually going to wrap up in the interest of time by asking Penny, Nigel, and Robin to give us some closing thoughts, and then Robin will sort of lead us out. So Penny, anything you'd like to close with?
Well, again, I would like to thank the Resource Center for asking me to present this brand new model. It was just debuted to the grantees in August, so about a month ago, a little less than a month, maybe a couple days. So it is brand new. The toolkit hopefully will be able to provide you with some very helpful resources. If you have any other questions or concerns, I believe one of the final slides will provide you with both my contact information as well as the HMRF TA email address, which is monitored constantly, and we will respond and help and provide resources as we can. So thank you again.
Okay, thanks, Penny. I would just say, really, as I started out, I think, if we want to do family strengthening work, we've got to work with mum and dad, and that's been a lesson that fatherhood programs took a while to learn, but I think have pretty much embraced it. And we need staff then who can talk to mum and dad. We need staff who model the relationship skills that are so important that they talk to clients about. So, if we can engage mum and dad, then we can enhance child well-being, and that's what this is all about. And I do encourage you to take a look at our Fatherhood Toolkit online. Again, fatherhood.gov/toolkit, and we refer to it as a living tool. It's not the be-all and end-all of anything. So if anyone sees anything there that they think, oh, it could be tweaked a bit, or why doesn't it mention this resource? We really do want to hear that, and you can send us an email to info@fatherhood.gov with that. And as Penny said, you're going to have contact info on the next slide as well. So thank you very much, everybody.
Well, thanks, Nigel and Penny. This is Robin, and I just have a few thoughts I want to close with, and then you'll have access to all the contact information that's been mentioned. I would ask you to please stay tuned for the survey that's going to pop up at the end so that we can get some feedback from you. It's very important to us that we are doing a good job, and we only know that if you tell us. So please stay tuned for that. We've heard a lot of good information today regarding the importance of healthy relationships, parent engagement, including dads, and how we can support families in their efforts to achieve economic stability. This graphic that you see represents all the stakeholder agencies that serve as safety net service providers, supporting families in their efforts to gain, maintain, or regain self-sufficiency. It also represents opportunities for the integration of healthy relationship skills. We're making progress. Child support's reframing itself from an enforcement agency to a service agency. School systems are offering healthy relationship skills to youth. Child welfare agencies are proactively working to provide wraparound services to support high-risk families instead of immediately removing children and then requiring punitive case plans of their parents. And workforce agencies are integrating interpersonal skills into their programming, but there's more work to be done. By integrating positive messaging about the importance of healthy relationships into each of the touchpoint opportunities reflected in this graphic, we can change our culture from a society that reacts to family stressors with a punitive response. We can change from that to a culture that proactively educates and supports individuals as part of a strategy to strengthen families and communities. We can only do it with all of your help, and we appreciate you joining us today, and we look forward to ongoing efforts to work together across the country to do just that. Malcolm Gladwell, in his book, The Tipping Point, refers to the tipping point as that magic moment when an idea, trend, or social behavior crosses a threshold, tips, and spreads like wildfire. So we hope that you will all help us be part of the tipping point in changing the culture for families across the country. Thank you for joining us. We look forward to having you join us the next time. And be sure to fill out that pop-up survey. So with that, I'll thank my co-presenters and thank the staff behind the scenes, Alan, Rebecca, and Jen. Thank you all. And with that, have a great day.